Patients want to know what happens on my date of consultation. Well, we're standing in one of the rooms where I see patients. In fact, in this room we take before and after pictures. That's why we have this blue background and these lights. I discuss with the patient what their interest is, of course. They fill out a form, a one-page form that tells me why they're seeing me. And then typically I'll show them pictures. I've got books of pictures. They've often been on my website. In fact, my website's very comprehensive. They've often read the parts that are pertinent to their interests. They've looked at before and after pictures. I think before and after pictures are very important. In fact, I tell patients that if they can view 10 sets of before and after pictures and they're happy with the results they're seeing, that's a good indicator that they'll be satisfied, because having the right expectations is very important. Patients need to know what they can reasonably expect as a result of their surgery. We discuss complications of surgery. We discuss blood clots. That's a major focus of mine. We use ultrasound to check patients for blood clots before and after surgery. I discuss the type of anesthesia that we use, where we perform the surgery. We have a surgery center that's on site, and we go for a walking tour of the surgery center. I talk to them about the anesthetic, the fact that they see me and follow up the day after surgery. They return the next day. We talk about their subsequent visits. And when they're interested in looking at times for surgery, my staff takes care of that. We typically operate on Tuesdays and Thursdays in the surgery center. And then the nurse does a nursing history as well, goes through all of that information. We do some basic tests before surgery. So I make sure that all of the patient's questions are answered at the time of consultation. I also have an opportunity to see them again when they return for their preoperative appointment, and we take pictures and do a preoperative ultrasound scan, do a basic blood test. Patients over 50, they get an EKG. There's a clinic that does EKGs for our patients. So we make sure that our patients are very well informed. That also helps with anxiety, because all patients are a little nervous about having surgery. And I find the more information we can give them and the more everything is just the way they expected, the less nervous they are.